Hello, my name's Bernie Rubin. I'm the Chief of Rheumatology at Henry Ford Hospital in Detroit. I'm here at beautiful Maui at RWCS 2018, and we're talking to some of our fellows who have amazingly interesting posters and cases to present. So this morning I'm here with Kyle Maier, who's from the University of Colorado Medical School. He's a first-year fellow. Kyle, tell me a little bit about this case.
Sure thing. So we saw this guy, a gentleman with a history of GPA, been treated about 2 years before he came in to see us. Sudden loss of vision in his right eye. Saw an ophthalmologist kind of way out in the boonies in Nebraska, and they told him, they think this is the GPA, so you need to get seen by room right away. Sent him over to see us, and we started evaluating him, took a couple pictures of the back of his retina, and things didn't look awesome. Started treating, and eventually got a vitriol test.
What did you treat him with? Were you treating him for a recurrence of his GPA?
Well, we didn't know exactly what was causing it, so we started on treatment for a number of things. A couple of things can do this. CMV, as was the case in this patient. GPA can look a little bit like this when it's reactivated in the eye. Also worried a little bit about herpes zoster. But kind of just started him on every treatment right out the gate, and then figured out what it was later on.
So what was it?
In his case, it looks like it was CMV retinitis, which is why this is a little bit interesting. CMV retinitis is pretty common in folks who have HIV. In fact, something like 20 to 30% of people who have HIV/AIDS will develop CMV retinitis.
So he had HIV and GPA?
He did not. He did not have HIV, which is a very rare thing to see. In fact, we did a literature review. CMV retinitis is reported in non-HIV patients very rarely. We saw 208 cases when we were looking for information on it, typically associated with transplantation and the meds you have to be on for that. But around 20% of those 208 that were reviewed had some autoimmune illness they were being treated for.
So for his GPA, was he on maintenance therapy? Was he immunosuppressed?
So really, he wasn't terribly immunosuppressed. He'd received rituximab after a few cycles of Cytoxan back in the day when his renal disease was more active. His last rituximab was maybe a year before this whole thing happened. But really, he wasn't terribly immunosuppressed at the time. Probably some residual effects of the rituximab, which we discovered later on in some labs, showed some hypogammaglobulinemia. We don't know if that was pre-existing to the rituximab or not, but possibly associated, which is another little interesting tidbit about this case.
And how did he end up doing?
So at first, we started him on a number of different treatments that are usually used in CMV retinitis. Ganciclovir and Foscarnet. He had to go to intravitreal injections of both of them, and eventually both of them at the same time. This guy was driving in an hour and a half from Nebraska to get injected in his eye twice a week or something like that. And he just wasn't, it was still progressing even on that therapy. So for that reason, we actually ended up adding leflunomide, or Areva, to that regimen, which, as we go into a little bit more detail in the poster, is not a very common thing we do, but it does actually treat the virus. And in this case, it's uniquely fitting because of his autoimmune condition, because it can treat both the autoimmune condition and the virus at the same time.
Did it work?
Actually, very, very well. He's completely stable on that therapy. He's on Areva monotherapy. He's had occasional steroid drops here and there, but really doing quite well on the leflunomide.
Well, that sounds like a very interesting case and a great outcome, and I'm sure all of us will enjoy seeing it when you publish it, hopefully in the near future.
We'll be working on it, yes, sir.
Thank you very much.